Hello and welcome back to Health for You. Today we're going to explore something fascinating that most people never think about. Your feet could be telling you secrets about your liver's health. Before we start, here's a quick but important disclaimer. This is not a substitute for professional medical diagnosis. If you suspect any liver problems, always consult a qualified healthcare provider and get the appropriate tests done. What we'll cover today are clues, early warning signs that might indicate a liver issue, so you can take action sooner rather than later. So let's dive in and discover the surprising connection between liver health and foot symptoms. The liver is a powerhouse organ, performing over 500 vital functions, from detoxifying the blood to producing bile for digestion. When it's under stress, its effects ripple through your entire body, and one of the first areas to show signs can be your feet. Why the feet? Because they're located at the farthest point from your heart. Any issues with circulation, nutrient absorption, or toxin buildup are often visible here first. If you notice small red or brown spots, sometimes shiny, on your lower legs, this could signal poor circulation. Poor circulation can happen for many reasons, including diabetes, but it's often linked to liver problems. Here's why. The heart must pump blood all the way down to your feet and back up. If the liver is stressed, it can impact vascular health, making it harder for blood to circulate effectively. These are small, web-like blood vessels visible just beneath the skin. They're more than just a cosmetic concern. They can signal liver conditions like cirrhosis. When the liver is damaged, it can lead to excess estrogen in the blood, which weakens blood vessels and promotes spider veins or varicose veins, often seen on the lower legs. Fun fact: the presence of multiple spider veins on the body can be a strong clinical sign for doctors evaluating liver health. Dry, cracked heels aren't always just a cosmetic nuisance. They can indicate deficiencies in vitamin B3, niacin, essential for skin and nervous system health, omega-3 fatty acids, crucial for skin moisture and elasticity. A healthy liver produces bile, which helps absorb fats and fat-soluble vitamins like A, D, E, and K. When bile production drops, nutrient absorption suffers, and skin health declines. This can lead to thick, dry, and cracked heel skin that's slow to heal. Persistent itchiness, especially on the soles, can be a sign of liver congestion. This may be due to bile backup or increased histamine levels in the blood. Many people mistakenly think it's plantar fasciitis, but in certain cases, it's actually linked to liver function. If your feet often feel uncomfortably warm or burning, this could point toward inflammation or circulation issues related to the liver. It's often accompanied by other signs like fatigue or skin changes. Strong, persistent foot odor can be more than poor hygiene. It can be a detox problem. When the liver is sluggish, toxins may be eliminated through the skin. This process often goes hand in hand with poor kidney and colon function. Remember, when one organ of detoxification is overloaded, the others often suffer too. This is a swelling in the lower legs where pressing the skin leaves a dent that lingers. Pitting edema often indicates fluid retention caused by poor liver function, sometimes due to low levels of albumin, a protein the liver makes to help maintain fluid balance in the blood. Yellow, brittle toenails or fungal infections are more common in people with liver problems. A compromised liver can lead to gut flora imbalances, allowing fungi and yeast to overgrow both inside and outside the body. This explains why people with liver disease may also experience dandruff, psoriasis, or pale nail beds lacking the healthy moon shape. Liver problems don't just appear overnight, they often build over years. Here are some common culprits. Medication side effects. Many drugs are processed by the liver and can strain it. Excess sugar, especially high fructose corn syrup, which promotes fatty liver disease. Overprocessed foods. Diets lacking raw, fresh vegetables starve the body of antioxidants and enzymes. Excessive alcohol, a leading cause of liver inflammation and scarring. Too much protein. Large amounts can create nitrogen waste that overloads both the liver and kidneys. If you want to keep your liver healthy or give it a chance to recover, here's what you can do. Increase vegetables. Leafy greens, cruciferous vegetables, and brightly colored produce supply antioxidants and liver-supporting compounds. Reduce sugar and processed foods. Cut out sodas, candy, and packaged snacks. Limit alcohol. Even moderate drinking can add up over time. Balance protein intake. Avoid extremely high-protein diets if you already have liver stress. Consider a healthy ketogenic diet plus intermittent fasting. This combination has been shown to reduce fatty liver and improve insulin sensitivity. The liver is one of the most resilient organs in the body. It can regenerate damaged tissue if given the chance. By catching early warning signs, even those on your feet, you can make changes that may prevent long-term damage. Your feet might not be the first place you think to check for liver problems, but they can tell you a lot. If you notice any of these signs, don't ignore them. Pay attention, take care of your diet, and talk to your doctor. Thanks for watching Health for You. If you found this video helpful, please like, share, and subscribe. And if you've experienced any of these foot-related liver signs, share your story in the comments. You never know who it might help.